Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist and practice independently in Shoreham, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimal health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
I'm Dr. Richard Jensen.
Wonderful to have you with us again in this dimension of House Call. Thank you for inviting us in your home or hospital or nursing home or workplace, wherever you might be, a church or a synagogue. We're considered an honor to be invited into your home. We're going to continue our discussion today of women's health problems, and the first subject that we're going to look at is cervical dysplasia. Certainly a serious health issue, certainly one that is preventable if proper procedures are followed. What does cervical dysplasia mean? It simply means changes in the tissue comprising the cervix, which is the neck of the uterus. It's always implicated in the HVP human papilloma virus. It is sexually transmitted. So, being that it's sexually transmitted, we have some solutions for that, don't we then? So if it's sexually transmitted, it usually comes of having sex with multiple sex partners, early age sexual intercourse, exposure to men, having intercourse with men with HVP, somebody or people who are using tobacco products, exposure to environmental carcinogens, intercourse with people with chronic cervical inflammation, and prolonged use of oral contraceptives, and of course, again, being involved with people with HVP infection. Now, there are 3 grades of it, which we call cervical intraepithelial neoplasms. They're diagnosed with Pap smear, and the 3 grades are mild, moderate, and severe. Now, because we're chiropractic physicians who practice orthomolecular therapy, certainly we do traditional sprains and strains and automobile accident or workers' comp type injuries and of that nature, but we're more nutritionally oriented from a scientific basis. We don't practice voodoo nutrition or unscientific approach to nutrition. And so we're going to look at some proven nutritional considerations for cervical dysplasia, and Dr. Jensen is going to begin that discussion with you.
Thank you, Dr. Lala. Well, we're going to look at some of those nutritional considerations that may be helpful in this. Is one, vitamin B12 and folate would be very important in this, as well as vitamin E, selenium, and zinc picolinate would also be good considerations to have. Then we can look at another condition called endometriosis. Now, endometriosis is excessive growth of the uterine tissue. It spreads to the ovaries and fallopian tubes, and it's also other pelvic organs that can be affected by this. Adenomyosis is also. Now, let's look at, there's small islets of the uterine endometrial tissue undergo excessive growth and spread into the muscular walls of the uterus and out into the fallopian tubes, ovaries, and other pelvic tissues, and even onto the colon. So very often the tissue fills with blood and appears as small chocolate-colored blobs, which are responsive to the menstrual cycle. When blood remains trapped in the tissue, it is referred to adenomyosis, which is a major contributing factor to painful menstruation. It does not spread outside the pelvis as cancer can. So then, treatments for this. Some of those specific treatments could be a DNC. Drug therapy could also be useful. Determine their hormone levels. So if we do a 24-hour hormone analysis, it can tell us what's going on with your hormones and help us work with specific ways to balance those hormones. Then another thing that may also add or exacerbate this condition is if you have food allergies. And therefore, another avenue of diagnostic testing is to identify which of those foods you are sensitive to. In which case, there are food allergy testing that checks in the blood whether your white blood cells are reacting to it, and therefore we're looking for IgE and IgG4 reactions. These are fixed as well as cyclic food allergies. And I've seen it where, say, somebody may be more sensitive coming up around their time of their menstrual cycle to where, say, in between, let's pick on dairy for a while. This person may be able to eat dairy products and have fairly mild symptoms, but as they approach their menstrual cycle, they're much more sensitive to the dairy food. So even if it's just snuck into a particular food as a little add-on type substance, let's say a soup that is used for a thickening agent, as a creamy base, they will have a much harsher reaction at that time. So some of the things that they're looking for in drug therapy is many times they're treating the symptoms, not the cause. And that's why you want to do the hormone analysis and the food allergies to find out what the cause of this may be. Okay, then another disease process is called polycystic ovarian syndrome. It's also known as Stein-Leventhal syndrome. It's non-polycystic, may or may not produce symptoms. So you might have the cysts, or you may not, and may not produce the symptoms in that case. But then there's also the ones that have the cysts or polycysts that do produce the symptoms. Usually this is diagnosed by the constellation of symptoms that surround it. A sonogram is usually used. Endometrial laparoscopy may be used, or biopsy. Now, some of the characteristics of these things. There will be undue abdominal pressure that's resulting, a lot of bloating that's taking place, or pressure that's in there. Bleeding, low back pain is also comes with this. Painful intercourse, low-grade fever, which is also known as Mittelschmerz syndrome. Hirsutism, which is an increase in body hair. Obesity, infertility, enlarged ovaries, anovulation, and excessive and prolonged menstruation followed by amenorrhea. One of the things that we find are people who have metabolic syndrome or problems with glycation tend to be more predisposed towards polycystic ovarian disease also. Aggravating factors with this would be hypothyroidism. Food allergies may aggravate this also. Having a diet that has high fat, caffeine, and refined sugar would also exacerbate this. Low water-soluble fiber intake may also make this more of a problem. Excessive levels of luteinizing hormones, androstenedione, and testosterone are found in people with polycystic ovarian disease. That's the increase in testosterone is what increases the hirsutism or body hair. Okay, so what we'd like to look at now is relationship of the pituitary and the hypothalamus. So, Dr. Lala?
We have what is called a relationship. All of our hormones are interconnected, and we have what is called an axis of hormone influence. So one hormone affects another, and we have this whole chain of relationship going on. And now we're going to talk about, in particular, the pituitary gland, and one of the principal hormones that it produces or secretes, and that's called FSH, or follicular stimulating hormone. Follicular stimulating hormone is produced by the pituitary gland, which stimulates the ovaries. The information or the transformation of the follicle after ovulation into the corpus luteum of the ovary is controlled by progesterone and progestin, which play major roles in preparing the uterus for implantation of the fertilized ovum, and of which the hypothalamus gland also is involved. In normal situations, progesterone is produced by the ovaries, our adrenal glands, and the placenta. A woman who enters menopause, when she enters menopause, her adrenal glands are supposed to produce female hormones, including estrogen, estradiol, and estriol, as well as testosterone. So all women have testosterone in their bodies. Progesterone, another hormone called DHEA, another one called ethylcholinine, another one called androsterone, cortisol, and cortisone. So hormones themselves are amino acids. And what are amino acids? Amino acids are proteins, and they are chemical messengers designed to control a vast, interrelated, changing network of organ system pathways and biochemical commands within the human body. So if these hormones are not functioning correctly, then those pathways and those relationships are not going to be as they should be. So how would we determine that? It becomes then extremely important that we would know the level of hormones that a woman is producing by her body. And the most simple, inexpensive way to do that is through a 24-hour hormone analysis. It looks at two different dimensions of hormones. It looks at the corticosteroids as well as the male-female hormones. Now, another thing that influences these testicular stimulating hormones in the pituitary gland are birth control pills, and then some people use what are called transdermal or natural hormone therapy. The natural hormone therapy pills are not as effective as the transdermal are, but there are a lot of these natural hormones produced that they say that they have progesterone in them, or progesterone ability to make hormones in the body, but many of them have such a small tincture, such a small amount, that they can't be effective. And so it becomes then very, very important that if you're going to purchase some of those, that you do so from a licensed healthcare practitioner who has the credentials and who has shown to prove that they're using pharmaceutical grade natural progesterone therapy. And there are a lot out there that are not pharmaceutical grade, and they don't help people, and that's why a lot of women who are using natural progesterone therapy aren't helped. It's not that their body is doing something wrong, it's simply because the product does not contain the ingredients that the seller or that the label on the bottle says that it has. So what does that tell us? It tells us that basically we're destroyed for a lack of knowledge. We really are, and then there's a little statement that we use quite frequently that says to see is to know, and to be able, when you see something, you know something, and that gives you the ability to begin to manage your health. And in this day and age, we have to take as much responsibility for our health as possible. That's one of the reasons that we produce programs like this, to help you kind of learn a little bit more, because even much of the information that's out there is not credible information. It's really not, but because it's on television or the internet, people think it is credible. Now, what are some of the natural solutions that one might want to consider? And Dr. Jensen is going to look at those for us now.
Thank you, Dr. Lala. Well, first of all, we want to take a look at some of the natural solutions. Maybe as a chiropractic or a doctor of chiropractic, we find that spinal care as well as metabolic care may help in these things. As we look at spinal care, the spine is actually a switchboard for the nervous system. It works with that nervous system supplying its nervous energy to all tissues of the body, including the cardiovascular and the hormonal systems, as well as all the internal organs. And as we look at that, we can say that that nervous tissue is also going to those sex organs and telling them to react to certain things, whether it's got the right blood flow to it or the right nervous flow. That will affect these tissues. Also, we want to look at it from a metabolic standpoint. And a metabolic standpoint, you're looking at whether it's getting the raw materials in order to do what it needs to do, such as if it needs some vital substances, which vital substances could be vitamins, which takes its name from a vital substance. These Metabolically, if there's any imbalances in a person's diet, their intake of vitamins, minerals, herbs, fats, and proteins, or even carbohydrates, all tissues and organs suffer and are rendered incapable of carrying out their specific roles. So that's one of the things. Also, what you might want to do is avoid those exacerbating type habits that people have, such as tobacco smoke and alcohol can deleteriously affect this. There's also Tribistan, is a botanical taken from a plant, and it has been reported to increase the body's natural production of testosterone, which is fine if it's within balance, if you need more testosterone, or in some cases, if you have too much in causing the hirsutism, it might be something to avoid. So that's why you really want to do the testing, because something that might be prescribed that's good for you may also have deleterious effects also. If we look at this slide that I just brought up, there is, this is showing the connection between the nervous system, which is coming out from the spine. Like we said, it's like the switchboard to the nervous system. And you can see how it has specific controls that are going out, in this case, to the stomach, to the liver, to the pancreas. Well, we're looking down here at the sacral plexus that comes out and feeds nervous energy and commands to the sex organs and the genital urinary area. This also has commands that are coming from up here too. And up in the middle, this is the hypothalamus and thalamus that we're looking at the controls for the hormone system. So if you have something that's out within this area, such as what we would call a subluxation, you're getting abnormal messages up to the brain, and therefore the brain is reacting to that and may give abnormal signals back to these tissues, having them react abnormally again, which can exacerbate the symptoms that are going
It's
on.
interesting, the statement of Thomas Edison said many, many years ago, and it's proving to be more and more true, not totally true, but that the doctor of the future will give no medicines, but interest his patients in the care of the human frame and in diet. And here we're talking about with that autonomic nervous system and the care of the human frame, that spine controls. It's the switchboard of the nervous system, as you said. The brain is like the electrical generator. It's sending the power out from the power plant, and all of those little, as you're going to talk, I suppose, a little bit later about all of that nerve energy controlling the spine, controlling the blood and the nerve supply out to all of these organs. So a woman with low back pains, or maybe not low back pains, may have an issue within her spine affecting those nerve and blood supply out to those ovaries
Absolutely.
and the uterus. Huh?
When we're talking about it's a balance in the nervous system with your fight or flight or rest and relaxation. And when we're looking at fight or flight, the body's natural response in a fight or flight reaction or stress is to shut off that blood supply to all non-essential areas that are non-essential towards getting away from this fight or flight. When we're talking about, say, in this case, there's some obesity that may occur, we're looking in fight or flight, your body is giving off some of these corticosteroids, which then talk to the liver to produce sugars out of usually protein from skeletal muscle. So that's leading to more sugar. That sugar adds to central obesity, and that central obesity is an exacerbating symptom towards some of these female diseases that we're talking about today.
Great. Well, do you have some pictures of the spine? That we find that many of the women patients who have dysmenorrhea problems, menstrual problems, hormone problems, that what they do is they come in for regular chiropractic spinal care because it helps keep that spine nice and free and flexible, therefore correctly influencing the nerve and hormonal relationships. Huh?
Certainly, and as we look at this picture that we have up here, we have a normal vertebrae in a normal position with a normal disc, and then right below it we see one that's been pushed backwards. Now what happens is when we push it backwards, now this disc here that has its weight on there has shifted. The disc has a jelly donut type of structure, And the inside of that is the nucleus pulposus, which works hydrostatically with our weight. And that gets shifted forward, creating more of a pinch back here. And what it does is it brings back more of the weight bearing, more of the stress along these structures here. And when that happens, we start to have joint decay going on back here, degenerative changes that are going on back here, that basically what happens is you start to grow bone in this area, as well as this pinch here. If you could see, this window is wide open, and this window is slightly pinched, and therefore is pinching all those nerves, arteries, lymphatics, as well as acupuncture meridians that are coming out of here. Now, the first thing that gets pinched off is actually the blood supply back here. That's the most susceptible. And then it starts to pinch off the nerves. But the blood supply that goes to and from the spinal cord through this window actually affects those segments above and those segments below. And so it's making a much more general area than just what would be affected here. This would also be affected by the blood flow change. So it's more of a group of nerves that take place and therefore cause more symptoms throughout the body. So
the chiropractor then, based on examination and most certainly x-ray, I mean, after, with my years of experience and years, and consulting in malpractice and issues and fraud issues with insurance companies, find that very often the chiropractor that's treating these people without a thorough examination, without good comprehensive x-rays of the spine, often doesn't get the good results that are possibly achieved, and or could misdiagnose the condition. And when you misdiagnose the condition, you mistreat it, and mistreatment leads to malpractice. So again, the importance of having adequate x-rays.
Well, certainly.
All right.
Certainly. Some things to remember. That you should always do your monthly self-breast exam, your yearly mammogram, and your yearly female exam should always be followed, particularly if you have these diseases, that they can be managed well. And so let's go on to more of this hormone control that we have.
Talking about how these hormones affect everything. So, for example, if I have a hormone that stimulates my thyroid gland, hormones that stimulate my pituitary gland, and hormones that from my pituitary gland stimulate my male producing organs just as much as a woman. And if there's some imbalance in those, we've got trouble. The problem is that very often what we're doing, particularly in managed health care, is that they're looking at symptoms. And I know managed healthcare programs and insurance companies that have tried to sign us up to be a part of their group are saying, well, you have no more than a minute or 2 minutes per patient, maybe sometimes 3 minutes per patient, and you've got to keep turning these people over. Well, you can't hardly even listen to someone of what their symptoms are in that short period of time, let alone begin to think, well, what diagnostic test should I recommend? What kind of treatment might be indicated? And again, with this so-called need to control healthcare costs, and there is a serious need for that, but very often what's happening in the medical doctor's office, the chiropractor's office, is that they're saying, well, you don't need to have those x-rays, you don't need to have those blood studies, you don't need to, that's if the patient confronts the doctor about that. They don't want to take the time to order those tests because it's going to go on their records that they've exceeded the allocations that the head office has said that they have per quarter. And so they just keep pushing people in and out, and they say, well, if they keep coming back and bugging me, or if they get worse and worse, then maybe we'll start ordering some diagnostic tests. Then on the other hand, sometimes they'll order a minimal diagnostic test in many respects to placate the patient. Well, if the patient doesn't know what an adequate hormone analysis is, or what an adequate x-ray study is, or what an adequate blood study is, they're going to think, well, the doctor's done that, they've done the blood test. But then, If they don't respond and they get really dissatisfied and they go to some place like a comprehensive healthcare center like ours, or like a medical comprehensive healthcare center, say like Mayo Clinic in Rochester, Minnesota, and all of a sudden they're starting to perform tests that were just as available to us, to the patient's medical doctors, just as available, and all of a sudden we're starting to come up with answers, at least the causes of the problems. And when you find the cause, you're always led to the solution. Whereas if it's going to be minimal care, you're going to say, well, we're just going to throw this drug at it, which is really basically saying, look, we've got a burnt cake here, we're going to throw some frosting on top of it and hope that it's going to go away. Well, when you cut into that cake, it's still going to be a burnt cake. So we have to determine the cause. Taking a drug or a vitamin or a homeopathic remedy or some artificial hormone is not treating the cause. It's like playing Russian roulette, like taking a gun and pointing at it and go, boom, let's see now, did that get it? Oh, it didn't. Well, let's spin the chamber, boom, let's see if it got it again. Or there's another approach called the shotgun approach. That's saying, well, we'll just aim the shotgun and see if any of these pellets hit the issues. But it's a sad situation because the doctors are under so much pressure to do as little as possible and to spend the least amount of time with every patient. And then if you get into some clinic that's a very high volume place, such as some chiropractic clinics are, they're just running them through like a piece of cattle hanging on a meat hook and running them through, or they've got a whole bunch of adjusting tables in a room and they just go down boom, 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 boom. If you want to talk to the doctor, you have to make another appointment. Now, I'm not saying that they're bad doctors, but I'm saying then that things get missed. And so your health is really your most important asset. And the more that you invest in it, the more that you make good investments in it. You can make some bad investments in it too. It's like very often, most of the patients that we've seen have already been to medical doctors, they've been to nutritionists, they've been to physical therapists, and they've been to chiropractors, they've been to medical doctors. And we look at those records and we say, my God, what were they doing? Because this patient has just bounced from one place to another and nobody's really gotten to the cause of the problem. And it's a serious issue because we're saying that we're going to wait for people to get sick and then maybe do something serious about it. And then often it's too late. Often it's too late, and it's hard to reverse a lot of these issues. Extremely difficult to reverse these issues. So if you're in a situation where they're running you through with a lot of volume, where the fees are less, sometimes we're saying, well, it's cheaper here. Well, there must be some reason that they have to do cheap things or devalue their services. It must be some reason that the doctor is evidently not very good because they can't attract people by referral that they have to advertise them in and then do it with real low fees. Well, when you often look, they're cutting corners then. They're cutting corners dramatically. And when you cut a corner, you cut the patient off. And often you don't know if we're good health care providers or not. Just because we're licensed in the state of Minnesota doesn't mean that we're good doctors. It does not mean that. And so just because I could be in a nice building or have a lot of patients clogging up the reception room does not indicate that I'm successful. So again now, the absence of symptoms does not necessarily indicate the presence of internal wellness. And the only way we're going to find out how this body is functioning correctly is to start to make assets and assays of what's happening on the inside of the body through proper diagnostic testing. And it's not that expensive. It really isn't when you compare how expensive it is when you start to lose your health, you start to begin to lose function of organs. It's a terrible, terrible situation then. So you take good care of your health now. It's the only thing you've got. Invest wisely in it. Seek out good counsel and advice and make sure that you find credible, good health care practitioners that are going to treat you as if you were Jesus yourself or his mother. Really, that's the key, that you're going to be treated as a whole person, honestly and with credibility. God bless you. What's that noise? Make sure we turn